Kia ora koutou. Ko te mihi tuatahi, he hōnore, he karoria ki te atua, he mangarongo ki te whenua, he whakaro pai ki ngā tangata katoa. E te tuakana Amohia, tēnā koe, he mihi aroha ki a koe mō tō tautoko ki a hau. E nā rōpū kai whakahaere, ko Jim, Jean, Cherie, Andrew, Amohia, tēnā koutou. Tēnā koutou he mihi mahana hoki ki a koutou katoa. E nā rangatira mā, e hui hui mai nei, tēnā koutou. He uri tēnei no tūhoi no whakatohia no Ngāti Pākehā hoki. Ko Taiara he te maunga, ko Hene Materoa te awa, ko te Mahurihuri te hapu, ko te Rewarewa te marae. He uri, ko Tane atua taku kāinga tipu, ko Debbie Goodwin tōku ingoa. Kia ora. I feel really privileged today to stand here as part of the Healthier Lives whānau, and I wanted to start with acknowledging the Healthier Lives governance group, the project team that supported this mahi and this study to happen. And I'm just going to hand it over to Amohia to talk a little bit more about that. Kia ora, Amohia.
How are we, Felix? Yep, I'm mic'd up and ready to go. Kia ora koutou. He mihi mahana kia koutou, kua whakarau ka mai I tēnei ata. I'm Amohia. Thanks, Andrew. You pretty much said what I was going to say. So now you're going to get ad-lib, Amohia. Sorry about it. I lead Whakauae Research. As Andrew said, we're the only iwi-owned health research centre in Aotearoa, and it's been my real privilege to be part of this kāhui governance group and to assist in this project. So that's my marae there, and Debbie's at the top. This is our overview. As Andrew said, and speakers have said this morning, both in your introduction and just before, many of you here in the room know that when we started the challenge back in 2015, we had two projects that were heavily co-designed at that point. They started with a co-design aspiration in their minds. So those were He Pikinga Waiora and Ola Ora. They had made a commitment to the communities themselves as they undertook their research that it would be a co-design process. As the challenge went on, we noticed that by February of 2018, the other three projects that we had commissioned were also developing models of co-design that were slightly different, but very much about their communities and the work that they were undertaking. And the governance group Kāhui Māori was becoming aware that those different models and what we were seeing were actually really unique, not just to our challenge, but what we knew from the wider health research that we were seeing as health researchers. So towards the end of 2019, as has already been alluded to, we had that phenomenal co-design workshop that was led out by Crystal Pekapo and supported by Megan's Ropu, Toi Tangata at that time. Just the response within that workshop, if you were there, you will understand, it really cemented for us the importance of co-design, what was emerging from our challenge, and we wanted to be able to share what we were seeing and the stories that we were hearing and how just the energy and the enthusiasm that communities and researchers were bringing together in their goals towards improving health equity for our communities. So, as Andrew already said, we kind of scanned around and looked and thought, who can capture these stories for us? And fortunately, what are you doing in the corner, man? Fortunately for us, as it happened, Debbie at that time was undertaking her PhD within one of those research teams, and she was looking at evaluating co-design within Māori communities. So we felt that she was perfect for the job. And because she was doing a PhD, she obviously had lots of time on her hands. So we asked her if she wanted to do some more work, and we were really, really grateful that she agreed to do it. And so for us, she was able to undertake a kaupapa Māori evaluation with the teams. It meant that we, as the governance group, methodologically, we didn't know who Debbie was talking to, so there was that ability for her in the research or in the evaluation to speak and have people speak to her honestly and truthfully about what they were seeing and what they were experiencing. And so we're going to touch a little bit on Debbie's work and what she found, and then kind of how we brought it all together at the end. Yeah. Do you want to move that on? Yeah.
Yeah, that's...
Yep.
Okay. So you've pinched some of what I was going to say, but
you can see we practiced
I did feel really privileged to be asked to do this, and I was excited about it, having worked with the Ola Ora project, kind of sitting alongside, not so much like immersed in it, but also the work that I do as an evaluation researcher, and my kind of focus on, my focus on the collective and how we do things together is kind of what really interests me, and has done for a long time. I've worked in grassroots community organisations, and so I see things from those lenses, as well as an evaluation researcher, which I've done for the last 15 years, but also as a facilitator within community groups around facilitating collective kōrero and collective planning and working together, and how we can do that better for our people. So I was excited to learn from these other co-design projects that had occurred in the Healthier Lives projects. And as part of my PhD research, of course, I found out, not surprisingly, that that there's a large lack of evaluation of co-design. We can't just expect that all co-design is going to work and improve and benefit everyone. So I had a healthy critical view of co-design, for sure. It was being pushed out in the government, and it looked good, and it was a new word a few years ago, probably 10 years ago. It used to be collaboration in the early 2000s. Now it was co-design. So it was like, well, what does co-design bring to us? And so I was really excited to talk to others about it. And I was hearing kind of in my work circles as well, some of the whakaaro. So how do we know? You can sit down.
I'll come back up when you need to.
So my question is, how do we know that co-design is going to benefit Māori, Pacific and Indigenous and minoritised communities? And some of the very small bit of literature that was finding that, it may not actually benefit us and just create greater gaps. So is it just another westernised approach was another question that I had, and what does that mean for us as Māori? As part of this study, it was largely a qualitative study. I talked to 16 people. 8 of them were on the university research or principal investigator side, and 8 were from the community partners. And they covered all of these 5 projects that we have here, and that you would be all familiar with and all part of, most likely. The focus of this evaluation or this study was around how co-design was conceptualised and implemented. So it's kind of more researchy, more focusing into, well, how did you do it? What did it look like? How did you talk about co-design? What were the challenges, and what were some of the solutions that you came up with in your project and in the journey that you had with each other, and what are the lessons learned? And we kind of gleaned some lessons from that as well. So that was the focus, and this is supposed to click over. Is it the green one? Yeah. 9 elements of good co-design. So what does good co-design look like to Māori and Pacific? What is a Māori and Pacific perspective of good co-design? 6 of these elements were actually identified in my PhD research, and that was largely with kōrero, with toi tangata. And we have some toi tangata representatives here today, kia ora Dario, and Megan over there as well. And that kōrero identified these things like these principles, these values, hononga, mahitahi, tikanga mena kawa, and that was about recognising and incorporating the tikanga of the communities that you're going to and that you're partnering with. Ngā pukenga, sharing of expertise and skills, ngā hua, equitable outcomes, and the other one was tino rangatiratanga. In this study, I identified another 4, which are the 4 at the bottom, rangatiratanga being a bit a crossover kind of concept for both of the studies. And these things reflect what some of the perspectives are from Māori and Pacific. So te mātauranga o tētahi hapori is about reflecting and having a cultural framing within your co-design processes, and also the outcomes. So reflecting culture and mātauranga from the community that you're partnering with was really important. This is bringing cultural context into the picture and acknowledging the importance of it and how it influences our communities. It also enabled researchers to gain a greater understanding of the community realities, how our communities work, basically. Kaitiakitanga is also another key principle. When we're doing this, often co-designing products, resources, programs, that when we're co-designing with Māori and Pacific, we would be incorporating often mātauranga from our cultures into that, and from our organisations that have been developed in Māori organisations, Pacific organisations. So this was really important to Māori and Pacific, and it's about looking after our mātauranga that is being used in the programs that are being co-designed. That may need some negotiation, some really good discussions, and sometimes some legal solutions. Rangatiratanga is about the need to be able to lead our projects, so Māori-led and Pacific-led research, and being able to identify what was important for those projects and what will drive those research programs that are important to us on the ground. And then our researchers in support of that are kind of our people that come up and help us get that research done. Te kōtuitanga taurite is about having that equal partnership. So Māori and Pacific community partners were adamant that they will want to be at the front end of the research. They want to be there to help make the decisions about what the research is about, what the focus is about, the scope, the methodologies, the resource allocation, all of that. So we also gleaned some lessons from our study, and while there were many lessons learned as I listened to the stories, here's 9 of those, and these lessons were sometimes hard-earned. You could tell that there was a lot of work and a lot of effort and a lot of kaha that went into the work that people did in the co-design processes. So the practices of co-design research require a lot more time than what we might think standard research processes, because we're talking about relationships, we're talking about doing it together. It takes time, and communities have their own kaupapa. It's recognising that they need, this is an extra on what they do, and so there's a pacing that needs to happen. There's accountability that communities have to their communities and to their relationships that they often bring into the research, asking for participants and whānau to come in. They have accountabilities to these people, to these whānau and to these other organisations. They bring in a great deal of social capital really into the project, and so respecting that and understanding the accountability they have to those people is really important. The co-design requires the right people to be involved, so there was reflections about how university researchers came in as really humble and wanting to listen and believing in the community expertise that they brought. So that meant a lot to communities, so more of that would be great. And also, the community investment time that it takes is quite significant on top of the other work. So while their funding is often short-term, their visions are long-term, and sometimes our research visions aren't that long-term. But communities, our community organisations, our Māori and Pacific organisations are there, many of them for long-term vision. We have a long-term vision for our people. And we stick around for ages. So the sustainability of co-design products are also really important to them. So it's not just about a 3-year or a 5-year, we'll do something and trial it. We want to be able to continue that after the research finishes. Yeah. So out of this, lastly really, out of this kōrero, firstly, we had some kōrero around co-design, some kind of critique about it being a catchphrase and losing meaning and overuse, and through overuse, and the many multiple ways that people talked about co-design. So this was really important. It's hard because, so the quote, it's hard because co-design has become a little bit of a catchphrase for the government, but then when you push them on what co-design looks like, it's like the same method but just packaged differently, kōrero, like I just got heartily sick of it because everybody has their own interpretation of what co-design looks like. So doing it right really matters. This varied nature of co-design means we need to be transparent and clear about the approaches that we use. And so we did, listening to the kōrero and the stories and the experiences, we developed a little model that we hope will support researchers that want to do this type of mahi, and I would recommend it. You have to be brave to do it, I think, because it does take a lot of time, effort and work. So this concept model, a Potama, the Co-Design Research Integrity Potama, we named it, is really about, came from understanding the nuances of implementation in co-design, so how people were actually implementing and what their aspirations were for implementing authentic co-design. So it doesn't really start at the bottom, but consultation only is at the bottom, and everyone was really clear that co-design is not consultation. It might include some sort of consultation, but it is not consultation. It's more of a partnership. The level that you move up to in level 1 is researcher initiated and led, obviously, but at this stage it might be sort of ad hoc involvement rather than a formalised involvement, which is level 2. So looking at formalising your partnerships is really good, and looking at how you might decide some of those things together and negotiate how that project will roll out. And our taumata is really, shared governance and decision making. That is where people really wanted to be in these projects, at the front end, deciding together and doing together our processes, our development. So the way we do co-design, it really does impact on the people and the outcomes and the relationships. And so while I've talked about some of the challenges, I suppose, and that it does take a lot more time and effort and a lot of patience and pacing and all of that, there was definite value that people saw in these projects, and because these projects were done fairly well, I would say, quite well. So the experience overall was good, and people saw the value in them. I hope it's an approach that we can sort of replicate, a gold standard for any future research. And there were heaps of unintended benefits and consequences from that process. So we want to do it well, and that means ensuring that our partnerships and transparency starts equitably from the beginning, and we want to be able to continue our efforts together, and hopefully some of these lessons and learnings, and particularly the principles that we as Māori see as important for co-design, we can incorporate into our future mahi. So I will leave it at there. I think Amohia's got something else.
One more. Thanks. So just from the perspective, so two perspectives really. So in my head as a director of an iwi-owned research organisation where we work with community, we have accountability to our iwi. I sit in that space and also as the researcher space, and we know that what we have found rings true. And so from that space, I can only thank you, Debbie, for the work that you've done and the voices that you've collected, because it's really important mahi. If I speak from the point of view of our challenge from the governance group, Kāhui Māori, we've got kind of three take-home messages, I guess, for our challenge. The first is, after all this time, we are able to put a stake in the ground, and we know that consultation is not sufficient. It's just not enough if we are really determined to meet our objectives around equity for Māori health outcome, for Pacifica health outcome, and for our communities who are vulnerable. They might not be ethnic communities or tiriti communities, but they're also vulnerable, and we need to work closely with them in a way that is authentic and with integrity. Secondly, we know that when co-design is done well, there are a huge range of benefits that accrue to those communities. We've been able to see it from the challenge side. We've had the real privilege of seeing what has happened in our communities as a consequence of when co-design is operating well. So it's not just benefits to us as a health research sector. Those skills and knowledges that are exchanged between partners endure with those partners. So the community can retain skills and knowledge that they might use in other places other than in health research. And at the same time, we know our researchers also benefit greatly from the mātauranga and the wisdom that is shared from our communities. So that was really huge for us too. And then finally, we also know, because of the nature of co-design, that it really does, as Debbie said, takes time, and that has huge implications for how we resource how we fund. So resource in two sets of ways: how we resource from a purely monetary point of view, our research projects, and how we resource and think about who are the people that we want to be working with alongside our communities. So we don't roll out people who are unprepared or unaware that there are some skills that you also need to work well and effectively with our communities. And so that resourcing has an impact for the likes of our funders, who need to think about, maybe, I'm not telling you, Stacey, what you need to do, and you know this already, but we would encourage our funders to think about the time that it takes to really build trustful and relationships. Because if you shortcut it doesn't come up with the amazing work that we've seen in this challenge, and has been a real privilege to see. The only thing we really have to do now is pass over to our... Oh.
Need a thank you page.
Oh, thank you. Okay, two things. Yes, I missed the thank yous. So, huge he mihi mahana kia koutou to all these people, the people that took part, that trusted us to capture your stories, to the to our kahui and governance group, and especially to Jim, who took hold of an idea that was random. I can remember where I was sitting, which was outside your marae, when we had the conversation about, oh, Jim, we need to capture this story. It was outside Whangiehu marae. So thank you for taking a punt. Thank you, Jean, and your team for all the support that you gave to us. We began this work, I think, pre-COVID. Yeah. So it's been a long gestation, but I think we've produced a product that we really want you all to use and to work with and to improve upon.